A medical student in Saskatoon is using art to express her feelings during this pandemic. Helen Tang is a third-year medical student at the U of S, and like so many things, her studies came to an abrupt halt in March. That disruption has turned into something tangible. She joins me now from Saskatoon to explain. Thanks for being here, Helen.
Absolutely, my pleasure.
Let's start back at the beginning. What happened to your studies when the pandemic was declared?
So I remember it was a Monday in the middle of March, and it was about the end of the day, around 4:30. We were wrapping up things in the obstetrics ward at the new hospital, and all of a sudden I received an email saying that I had to immediately leave the hospital. So from that point on, we didn't know when we were going to return to the hospitals or clinics, and currently they still haven't given us a timeline.
Initially, what was your reaction to being sent home, and how has that changed with time?
Initially, I was relieved. So the week prior, I had been hearing from friends at other medical schools that they were being pulled from clinical duties due to the pandemic. And I was just thinking that it would be only a matter of time before we were released from clinical duties as well. I didn't want to be in the hospital, perhaps inadvertently spreading the disease or using up the PPE stores that were already on low reserve in the hospital. And I wanted to save those for the medical personnel who were working frontline. But as the days passed, I started to realize that this relief was turning into frustration. Now, frustration for a few reasons. First is we've spent the last 3 years, going to school, learning about medicine, and the last 6 months I've been working directly with patients. So I have a foundation of how to provide good patient care. So all of a sudden, this knowledge that I had developed, I could no longer use to help with frontline efforts. And also it's a bit frustrating because we're expected to essentially sit at home, and there are some academic resources that we can access online to further our learning, but it's not a whole ton compared to what we were doing in the clinics and hospitals. And furthermore, we're paying full tuition while not receiving the full educational experience. And also that frustration has a little bit of underlying identity loss as well, because we've spent so much time in the medical community. It felt devastating to not be able to help and focus on medicine in a time where the whole entire world has focused on medicine.
All that being said, how did this become an art project?
So originally, I was scheduled to do an elective at the University of Calgary in August, and this elective was called Medical Humanities. So that was some sort of arts project to do with medicine, and my preceptor contacted me asking me if I wanted to do the elective now because all our visiting and out-of-province electives were soon going to be canceled. So I decided to do it now and focus my project on the COVID pandemic because I was feeling so many different emotions, and I wanted to connect with my classmates to see if they were feeling those emotions as well. And I felt that drawing was the best way for me to portray these emotions because I've been drawing my entire life. And I think art has this beautiful way of eliciting conversation that other non-artistic forms of communication might not be able to do.
So you interviewed your classmates about their experiences, and what ended up coming out of those discussions?
There were a few themes that came out. First, like I said before, was just a frustration. I think we're all seeing the global COVID pandemic headlines mount, and we're hearing about PPE shortages, hearing about doctors dying front lines, hearing about so many people being infected, and yet we are sitting at home unable to help. And also all of our mentors and our physicians that we worked with so closely for the last few years, all of a sudden we're not able to give back to them like the way that they gave back to us for the last several years. So that was extremely frustrating. And my classmates also echoed the sentiment of loss of identity. For a lot of us, not only were we doing medicine for the last few years, this is something that we wanted our entire lives. So to not be able to help in the pandemic effort and also not be able to learn from how to handle a pandemic properly, that is extremely frustrating and contributes to the loss of identity.
How are you and your fellow classmates supporting each other from a distance?
We've come up with quite a few initiatives. So at my school alone, lots of people are For example, running yoga classes or running cooking classes. And there's also national initiatives that are doing very similar things. I think another way that we're supporting each other is by helping with volunteer pandemic relief efforts. So, for example, going to the public health phone line or running errands for physicians and other healthcare workers and connecting with senior people in remote communities. That allows us to connect back to our sense of purpose and sense of connection that we so missed with our patients. And that means it's like another way for us to talk about that with each other and find this common sense of identity and community.
Helen, while we're all safe at home, waiting this out, what's next for you?
What do you mean by that? Like, do you mean in terms of my education or art?
Either.
Okay. Well, I guess next is just waiting to hear back about when we will return to school. So, last I heard is we will be returning sometime between the end of May to the beginning of July. Hopefully, it's a little bit sooner. And in terms of this art project, hopefully one day I'll be able to share it in an in-person gallery exhibit. I really want to be able to share these emotions that we've all gone through and record this for future generations so that we're able to understand how the pandemic unfolded and maybe do a little better in the future as well.
Helen, thanks for sharing your story with us.
Thank you so much.
Helen Tang is a third-year medical student at the U of S. You can see what she's created on our website, cbc.ca/sask.